Manager asks to wash all the patients before 10 a.m. What is the most appropriate response? Talk to the manager. Tell him that holistic care will be compromised. A newly appointed staff makes repeated errors, leaving patients' safety at risk. As a line manager, what will you do? Talk to her privately, identify her difficulties, provide support and appropriate training. Student nurses performs wrong procedure. What should be done? Stop them, provide training and assess competency. A patient is for surgery, but her BMI is low. To whom should be referred? Dietitian. Subcutaneous insulin injection should be given at 90°. What is patient-centered care? Take patient as a whole and deliver appropriate care. When should a nurse administer broad-spectrum antibiotics for a patient with sepsis? Immediately after collecting blood samples for culture. What is advocacy in nursing? To inform, mediate and support on behalf of the patient. Patient refused antihypertensive tablet, and her daughter asks to crush the tablet. What will the most appropriate response? Tell her that it will alter its therapeutic effect and refuse to disguise. A patient want to share a secret. What will be your response? Tell her that only relevant information will be shared with others. Community hospitals provide rehabilitation, respite care, primary care, acute care, physiotherapy. Which condition requires chest compressions and ventilations rather than defibrillation? Asystole. Patient's initial GCS is 15. How frequently should be monitored then? "30 minutes. A patient deemed to have capacity refuses blood transfusion on the basis of religion. What will you do? Accept his decision, as he is aware of the consequences. What will you consider while delegating a task? The person's competency to perform. Average heart rate of 1 to 2-year-old. (110 beats per minute). 16-year-old is anxious during physical examination. Stay with the patient. Don't intervene directly. Provide support by non-verbal communication. How is compassion defined? Maintain dignity, empathy and intelligent kindness. How will you organize a patient's care plan? Assess needs, diagnose, implement and evaluate. Needing plan. How will you regard a patient's end-of-life care? Treat with dignity and respect. Why the family is encouraged to talk with a coma patient. As they can hear. What is the common cause of airway obstruction in unconscious patients? Tongue falling back causing obstruction. A patient with blood transfusion complaints, pyrexia, and lower back pain. What will be the reason? Severe transfusion reaction. What is the nurse's role in caring for a patient with severe anaphylactic reaction? Call for help, assess ABCD, keep anaphylactic kit ready, stay with the patient until help arrives. Which condition exhibits edema as a sign? Right ventricular failure. What will you do if a patient doesn't know English? Book an interpreter. Explain the process, maintaining confidentiality. Allow patient to ask doubts and clarify. What should be done if you are given a new wound dressing pack? Refer to another practitioner, and do only once you are competent. You are assigned to a patient with unfamiliar diagnosis. What should you do? Read the care plan and notes. Act within your competence. Ask help from senior nurse when needed. Patient had allergic reaction to medicine at home. What should be done? Act to prevent harm. Inform prescriber, who can report to MHRA through yellow card scheme. Malnutrition universal screening tool, or must medium risk. Record dietary intake for 3 days.